Hi everyone, I'm Dr. Karishmakagodu, certified plastic surgeon in Bangalore, and today we're going to talk to you about the lower eyelid surgery, also called as the lower eyelid blepharoplasty. This is a procedure very commonly performed for those individuals who have problems of excess skin in the lower eyelid, excess fat bulges, sometimes a combination of the two. They also complain of heaviness in the lower eyelid, puffiness in the lower eyelid, and very commonly under eye bag. When we do perform the lower eyelid surgery, we have to make sure that you are well analyzed. We have to examine your eyes extremely well. We need to know about certain eye conditions that you have. We will have to check your vision, check for any issue of dry eyes, check if you have any internal eye diseases or you are suffering from any eye disorders. We need to make sure and analyze how much of excess skin is there in the under eyelid, also see the kind of popping fat bulges and to what extent are these fat bulges protruding from the skin. A lower eyelid surgery is performed usually under local anesthesia with a mild sedation, but some patients are uncomfortable being awake during the procedure, so we like to also perform it under general anesthesia. This surgery has to be performed very precisely with a high grade of precision and detail. Why? Because it is your center of the eye, and the eyes are always the center of your facial aesthetics, and it's very important that we take care of these certain details when we are performing such a procedure. It is a very minor procedure which takes about 45 minutes to 1 hour, but a few details have to be taken into consideration. Before the procedure, we will do extensive markings on your lower eyelid and we decide what is the extent of excess skin to be removed. We will also have to see how much of fat has to be taken out. Sometimes these fat bulges may be concentrated to a certain area of the under eye area, sometimes in the inner portion and sometimes in the outer portion, because these fat bags usually pop out because of the laxity of certain ligaments which are there between the bone at the under eye region extending up to the skin. So these ligaments usually at a younger age are holding those fat bags. Having these fat bags is one of the most common and first signs of aging, and sometimes we cannot defy aging, and when we start seeing the appearance of these fat bags popping out, it becomes really unaesthetic, and that is why they usually come to us to correct it. There are two kinds of approaches that we do for an lower eyelid surgery. One of the approaches is from the external side, and this incision is made just below this eyelashes, and there is a line there which is a natural crease in a male or a female, and this gray line is through which we enter underneath the skin, remove the excess skin and also approach the fat bags which are there below the lower eyelid. Sometimes there is a different approach called as the transconjunctival approach, and in a transconjunctival blepharoplasty we approach the eyelid from the inside, that is within the lash line, and from the internal aspect of the eyelashes is where we make a cut. I usually like to perform a lower eyelid blepharoplasty through the external incision, and trust me, the scar is highly invisible after a month or so. In fact, we just put 2 or 3 very fine sutures on the external aspect, and these stitches are removed by the 5th day. And because we are making the incision along your existing natural crease line, you will see that the scar is hidden within this crease underneath your eyelashes. One of the few details that we take care during this lower eyelid blepharoplasty is seeing how much of fat that is bulging needs to be removed and how much can be saved behind. Removing too much of fat from the under eye area can later on create an appearance of hollowness and sometimes flatness, and then the person feels that there is too much of hollowness and the aging is feeling more extensive. So sometimes we remove a part of the fat, sometimes we rearrange the fat in the lower eyelid, and sometimes we just move the fat into areas where the fat is actually needed. Removal of too much of this fat in the under eyelid area can also create a look of more aging at a later date or few years later. The lower eyelid procedure is a daycare procedure, takes about 1 hour. You can go home immediately after the procedure. After the surgery, we I place a few tapes at the under eyelid, and these tapes I keep for about 2 to 3 days. This will help in your swelling. I remove the stitches at around the 5th day. Redness, mild swelling and bruising is seen for about a week. We advise all our patients to put a lot of ice after the procedure, and that helps to reduce the swelling. When they go outside the house, we tell them to wear sunglasses so their movement is not restricted, and the whole recovery in general is about 4 to 5 days. So I hope you got enough information about the lower eyelid blepharoplasty, but I do insist that you watch our other videos on blepharoplasty, and if you feel you need a little bit of peri-orbital rejuvenation or some sort of a rejuvenation around the eyes, do visit Dr. Karishma Aesthetics. You can directly book an appointment on our website www.kaesthetics.in, or you can call 91089 69006. Take an appointment, have a personal consult with me, and we can try to assess which procedure suits you best.